thought she had the care that she needed. And we left her that evening. So I was really in shock.
That's how Lynn Francis felt when her mother, Bridget Denny, unexpectedly died. Denny, 65 years old, was a residential school survivor. She spoke the Mi'kmaq language and was a mother of 5 and had 15 grandchildren. The active member of the Eskasoni First Nation unexpectedly died on January 20th, 2021 at the Cape Breton Regional Hospital. Denny was admitted the night before for pain and complications due to diabetes. Mary I. Jo Francis, Denny's daughter-in-law, says she died the next morning. The doctor on shift said an autopsy wasn't necessary.
She advised that an autopsy wasn't really needed because she had so many health issues, but really we didn't know how she died.
Her body was cremated, and days before the funeral, the family found out from another patient that Denny had fallen in the middle of the night.
And that we learned that she had fell the night before. That was not brought up when we had the conversation with the doctor and the nurses. We were there for hours after she had passed away. The whole family was there.
Jo Francis obtained Denny's medical chart, filed a complaint with the College of Physicians and Surgeons of Nova Scotia.
But if we had known she had fallen, that all this stuff was wrong with her the night before, we would have wanted an autopsy. The medical examiner wasn't even made aware of her death because it was just kind of like brushed off.
Jo Francis met with hospital staff for answers with no success.
I would say it was heated, actually. It was a lot of back and forth, but a lot of anger and frustration from us. We wanted answers, and we didn't get any. We left there even more angry than we were that day because they had nothing. They had nothing.
The incident sparked an investigation under the Protection for Persons in Care Act. The report concluded the facility failed to provide adequate care based on lack of documentation in response to the patient's unwitnessed fall, including failing to document the affected patient's post-fall vitals and post-fall assessments firsthand. Staff inaccurately completed the affected patient's admission fall risk assessment and hourly checks. No documented evidence that post-fall neurovitals and a SIMS report were completed. And it is beyond the scope of this investigation to determine if this contributed to the patient's death. Associate Professor Lynette Reid, Bioethics at Dalhousie University, cannot comment directly on Denny's case, says inadequate care is unethical.
But when unsafe care is being delivered, then a line is being crossed.
According to the report, even the staff were shocked by her death, saying, all staff reported they were surprised and shocked by the death of the affected patient. One staff reported the death was unexpected. And that means certain protocols had to be followed, but the hospital would not provide their policy when asked. And the medical examiner should have been notified, but the hospital didn't.
I was disgusted with the report. Can't believe that they're actually treating patients like that. Especially you're native. They brush you off.
The report says Denny's fall risk assessment was inaccurate, as evidenced by the incorrect scoring for 2 identified risks, that is, IV and history of falls. It did not include the date, time, and signature of the person who completed the assessment. This inaccurate assessment resulted in the affected patient being identified as low risk for falls, and therefore the additional high risk for falls interventions were not considered. But was Denny's death the result of discrimination? Her family is looking for answers, and I'll bring you more of this story in part 2 on APTN National News.